All right, hello guys and welcome. Tonight we're going to be talking about shoulder pain in gymnasts, the what, the why, and the how. So shoulder pain is typically more common in male gymnasts, but it can be very prevalent in female gymnasts as well. So everything that we're going to talk about here today is pretty much going to apply to both male and female gymnasts. So before we start, I just want to share with you who am I. Some of you might know who I am, some of you might not. My name is Sarah Wynn-Ferruza. I'm a doctor of physical therapy, a certified strength and conditioning specialist, selective functional movement assessment certified, and a specialist in fitness nutrition as well. I'm a former gymnast, and I currently own Perfect 10 Physical Therapy, where I treat gymnasts and similar athletes for a variety of injuries and also work with different gymnastics teams on injury prevention. So I just want to talk a little bit about the goals of this presentation. And this presentation is meant to help you get a better understanding of shoulder pain in gymnasts. It is meant to help you screen your gymnasts for future problems and to learn some exercises to incorporate into your routine. This presentation is not meant to exhaust all possible diagnoses and pathologies that could be present in the shoulder. It's definitely not meant to license you to diagnose your athlete or treat your injured athlete. And it's also not meant to replace medical advice. Obviously, most of you I do not know. So when I'm speaking in general terms. I'm not speaking to any specific athlete or specific injury. There are exceptions to every rule, so this is just kind of an overview. And by continuing to listen to this presentation, you acknowledge the above, that this is not meant to replace medical advice or teach you how to diagnose or treat. It's just meant to be informational, general overview, and just help you improve your injury prevention skills more than anything, and some screening techniques. So first, I just wanted to go over anatomy of the shoulder. So we have, this is kind of a view from the front, but we're seeing to the scapula or the shoulder blade here. We have the clavicle or collarbone here just to get you oriented. This is a right shoulder looking from the front. We have the deltoid muscle here. We have the rotator cuff here, so this is going to be an important structure as we continue to move forward. We have the biceps muscle here, and we have the labrum right here. So the rotator cuff, we can see it here, and it actually extends all around the shoulder blade here, just not pictured. And then the labrum right here, this is going to be another important piece of what we're talking about. And what this labrum actually does, you can kind of see the head of the shoulder joint, the head of the humerus, kind of sits into this joint, and the labrum kind of vacuum seals that together. So those are going to be some important things as we go forward. So shoulder injuries in gymnasts generally are going to occur either to the rotator cuff or to the labrum. There are a lot of other structures here, but generally it's going to be involving either the rotator cuff or involving the labrum. So I'm going to go a little bit deeper into that, because you might be saying, oh, well, I've had gymnasts with 10 or 12 different diagnoses, and you're telling me there's really just two. That can't be the case. And there's not really just two, but there's two most common ones. But when we look at it, so I consider a rotator cuff diagnosis type 1 shoulder pain in gymnasts. And this is something that I've come up with myself. This is not something you'll likely see elsewhere in the research, but just for my own mind to kind of understand that. So this type 1 shoulder pain, it can be referred to as tendonitis, bursitis, impingement, muscle tear, tendinosis. All these things are basically referring to a problem in this red part right here. Okay, and we'll get a little bit deeper into that later. Then for type 2, when I talked about the labrum, could be diagnosed as instability, MDI or multi-directional instability, hypermobility, and also bursitis. So this is where things can get a little bit confusing, because either type could be diagnosed as bursitis. But we're gonna come back here to this anatomy picture and talk about that a little bit. So right here you see the space, and we have the roof that's made by the acromion. That's kind of the top bone of the shoulder here. And then we have the floor, which is made by the head of the humerus. And in between that, we have this rotator cuff tendon and muscle, and the bursa. So you guys can probably see and imagine that if that rotator cuff tendon or bursa, the rotator cuff tendon, I'm sorry, is inflamed or irritated, it's going to be kind of compressing on that bursa and likely make that inflamed and irritated as well. So that's where we could get this bursitis problem. Same thing here, we come down a little bit lower and there's some trouble with the labrum. That's as well gonna kind of push everything up and push that bursa up against that acromion and again get that bursitis. So bursitis is basically just an irritation or a swelling of the bursa. So I kind of liken that to like blisters on your hands, rips on your hands. So when you have that friction between the bar and your hand, you're going to develop these bubbles here. And if you continue to have that friction, that bubble is going to continue to get bigger. But the bubble is really not the issue, right? The issue is the friction between your hand and the bar. The same thing here, the issue is the friction between the rotator cuff and the acromion or the labrum and the acromion. And that bursa is just getting blamed for it because it's just getting inflamed. And it's a little bit easier to diagnose. So you can see it's kind of one of the larger structures in this area. So sometimes, you know, you'll go to the doctor and they'll kind of poke right on that area and say, oh, that's definitely bursitis because your bursa is inflamed, which is not wrong, absolutely is. But I like to take a step further back and let's see why is that inflamed. Because inflammation, we can get down in countless ways. We can take anti-inflammatories, we can rest, different things like that. But if we don't address the underlying issue, it's not going to actually make a difference. So how do I differentiate between these two types? So there's a really simple screening tool that I like to use. I had one of my gymnasts demonstrate it here for you. So you're going to have a gymnast who's having some shoulder pain, or maybe they're not having shoulder pain yet, and you're just looking to screen them. Reach up overhead next to their ears like this. And you're going to ask them if that causes any pain or discomfort and if they're able to get all the way up. And then you're going to ask them to bring their arms out to the side like this and even a bit behind them. And you're going to ask if that causes any pain or discomfort and if they're able to get them all the way out to the side. And so now what does this tell us? Well, when we do this T motion, the arms coming out to the side, it's going to create a little bit more space back here. So the rotator cuff is probably going to be okay. But what's going to happen is that head of the humerus is going to push forward into the labrum. So if there's some trouble there, if there's some trouble with the labrum, it's likely going to cause some pain when we push it forward like this. Conversely, when we reach up overhead, these structures on top, the rotator cuff, tendon, and muscle, are going to be pinched down. The space for them is going to be closed down and likely going to get a pinching or painful feeling coming all the way up overhead if that's the case. So this is just kind of a quick way to screen between them and get an idea of what your athlete might be dealing with or what they might be predisposed to. Sometimes they may not generally have shoulder pain doing whatever, kind of going about their normal routine. But when we ask them to get in these end range positions, they may. And you may look at this and say, well, none of these positions are really that crazy, and they're not. But just doing it kind of in isolation may bring out some discomfort. And now I want to just talk for a second about this position, this overhead position, and how it pinches on this rotator cuff tendon. And you may say, well, most of gymnastics, 90% of gymnastics is done in this position or some variation of it. And that's absolutely true. But some athletes, if they do have some shoulder pain or some restrictions in their shoulders, they'll get that motion from somewhere else, and they'll be able to hide it to do handstands, giants, things like that without an issue, but they don't have this end range motion or they do have some pain here. So unfortunately, I don't have a side view, but if you look at this gymnast right here, you can tell her arms aren't all the way up behind her, but yet she's a high-level gymnast, but she's able to compensate using other areas. So we really want to break it down here. Also, something especially right now with the times that we're in, quarantining, virtual school, a lot of time spent at home, sitting on the couch. I ask my athletes a lot, where do you do your virtual school from? And a lot of them say, on their bed. And if their parents are present, they'll say, yeah, on her, she's on her bed or he's on his bed, bent over, hunched over, everything like that. And what that can cause is some stiffness kind of in this area in the mid back. And now we leave that, we sat on the couch from 9 a.m. to 3 p.m. We leave, we head to the gym, and now all of a sudden we're up overhead here. We're definitely going to be pinching on these structures. So that can be a little bit tough. So we're looking at type 1, type 2. So if we're seeing an issue here, that's going to be more of the type 2 diagnoses with these things. And if we're seeing an issue here, that's going to be more type 1. So what's the difference in the approach to treatment? So when we're looking at type 1, when we're looking at rotator cuff type things, impingement, tendinitis, things like that, we're doing more work in a neutral position for the shoulder. So while we're kind of healing, while we're getting away from that, we're not working in these end range positions over here. We're kind of have the arms down a little bit by our side, open up that space for the rotator cuff tendon. And there we're going to work on some muscle balancing and stretching tight muscles. So usually what I see with this is the muscles in the front, the pecs and everything like that, especially in the gentlemen, are kind of overdeveloped and strong. They've spent a lot of time on rings and things like that. But the muscles in the back of the shoulder are a little bit weaker. And that imbalance kind of cramps down, closes down on that space for the shoulder and causes trouble with that rotator cuff. So we want to do a little bit more balancing there. We also want to avoid the end range of motion in training and conditioning. So for type 2, we do want to work at end range. So something I didn't say earlier, when we're looking at somebody who has this rotator cuff type diagnosis, tendinitis, impingement, something like that, these guys are generally, guys and gals are generally going to be the athletes that you see as more muscular, maybe more stiff and tight, more overdeveloped, things like that. And they're going to have these muscle imbalances where gymnasts with these labrum issues, not always, but a lot of times are going to be the ones that are quite a bit more flexible, maybe a little bit less strong. They have no trouble bringing a full circle with their arms, things like that. So with these people that have that great range of motion, we want to teach them to control it. So we need to work at end range. We do need to do conditioning and rehab in all positions. We may want to avoid end range in skills. What happens with these athletes sometimes is they go to the end of their available range and then they go past that. And then that's where we get some of these issues with the labrum. So we may want to avoid that just while we're kind of healing and getting better. We want to avoid stretching. Most of these athletes are already over flexible. And we want to focus more on strengthening and stability. So which is more likely? And it depends on a variety of factors. So like I said, people at risk for type 1, they have kind of a forward head posture. Arms are kind of turned in tight in the front like this. Strong, well-developed muscles and tightness in the mid-back. Risks for type 2, like I said, generally going to be you're over flexible and mobile. Also just doing release skills on bars with that labrum, any sort of distraction force can cause some issues. So athletes who are really doing high level releases and catching and jerking from the shoulder, going to be more likely for this. They may generally be a little bit more underdeveloped or under muscular. So when to seek treatment. So something that I like to talk about is the rule of threes. I'll be writing a blog on this week. You can visit my website and check that out. But basically, if you have pain that's limiting your ability to walk for the lower extremity or move your joint through a range of motion in the upper extremity for more than 3 hours, you want to seek treatment right away. If you have pain that's persistent for more than 3 days, you want to seek treatment. Or if you have pain that's intermittent for more than 3 weeks, you want to seek treatment. If you're unable to differentiate between the types, if everything's kind of painful, you want to seek some treatment. And if some independent strength work or rest work makes things worse, definitely want to seek treatment. Then again, if there's an obvious dislocation or tear. So this is something where you know right away the athlete can't lift their arm, or it's super, super painful. They're not able to hold their arm up like this or out like this at all, not able to perform these screening tools. You definitely want to seek treatment. We're going to get into a few exercises that I really like, but we certainly don't want to be doing these exercises with somebody who can't really move their arm. So This is the kind of thing you want to get them checked out right away. They may need some professional help, some physical therapy before they can get up to the level of doing some more exercise in the gym. So we're going to talk about some of my favorite exercises for shoulders for gymnasts. So yes, I use weights. Forces on the shoulder in gymnastics can be up to 16 times body weight. So even just in a handstand, the gymnast is supporting body weight. So let's just say we have a 100-pound gymnast to keep it really easy. In a handstand, they're supporting 100 pounds of weight. So we think that's completely normal. That's fine. But if sometimes, I have a gymnast stand up, if I ever had somebody hold 100 pounds up overhead, you're like, oh my gosh, what are you doing? They're going to get bulky. They're going to get this or that. They're not. It's the same forces that are on them. It may even be more controlled. So I do like that. I do advocate for the use of that. We need to prepare our bodies or our gymnast bodies for what they need to do for their skills. So if we just do all this kind of body weight basic conditioning, and then we ask them, okay, go do a Takacha, go do a Jaeger, and you're catching and your shoulders taking even more than maybe 16 pounds on some of those release moves, or 16 times your body weight, we're just asking for trouble. So I do advocate for the use of some weights and to prepare as well. So for those type 1 injuries, rotator cuff stuff, I've included a couple of my favorite exercises here. Let's see if we can get them to open. So this is just some thoracic spine stretching here. You may be familiar with this already. Then we can look at this is another kind of thoracic spine stretch. You want to make sure that's moving really well so the shoulder blade has room to move and get out of the way of those rotator cuff tendons. We'll pass that. And in this one, we kind of work on the shoulder external rotators by holding a band really still. This looks really simple. Looks like he's not really working his shoulders, but I guarantee you he absolutely is there. So not letting that band pull you close together. This is going to be super important for gymnasts. And then our last one for type 1. We got an ad here. We'll pass that up in just a second.
The foam roller pec
It's going to be some
a
stretching
great option to improve overhead mobility. It's much
on the foam roller
as far as you can.
here.
The goal
Working
is
on
to
stretching
relax
out
your
that
upper body
chest.
in this position and hold.
Next, we'll look at type 2 and a few exercises there. So these are going to be, again, more strength and stability exercises. So side plank lifts here. Gymnasts need to absolutely be able to support themselves on each arm. So working on supporting themselves in this position, that humeral head is kind of jammed into the socket. So we're definitely safe. With these athletes with a type 2 instability problem, we do want to be aware of dislocation. So we don't want to do activities where dislocation is really likely. There's another one is kind of combining core strength and upper extremity weight bearing. We're going to do a plank and be pulling the weight back and forth here. And that's going to work on support. And then as we pull across, it's also going to work on some strength and stability. Next here, this is one of my favorite exercises where we're holding a kettlebell up overhead and just walking. And this is just going to work on stability in that handstand position. And then this last one here, one of my favorite exercises, we're gonna balance the kettlebell upside down and press it straight overhead. And this is where we kind of catch some of those gymnasts that seem pretty strong, seem pretty stable, but usually they cheat. Having to balance this kettlebell will prevent them from being able to cheat. So that will kind of show us what we're working with. Gymnasts who are pain-free can do all of these. They're all great exercises. And then I've added just a few more here. So we'll look at this. It's called a kettlebell arm bar, where we kind of roll and work on the stability. But again, somebody with that type 2 instability, this wouldn't be a great position for them unless they're completely being free and pretty strong and stable. You know which athletes you can kind of push their stability and which you can't. We definitely want to stick with a light weight for all of this. Next one here is some rotation. So this is going to be kind of same position. This is super important for our athletes that are doing any kind of pirouetting work on bars, pommels, P-bar, anything like that. We're kind of rotating in and out there, working on that stability through the rotation. And we've got one last one here. And this one is one that we should be pretty familiar with. Most of our athletes are already doing this, but just working on that single arm stability. We want gymnast arms to be strong enough to support them one at a time, so that when they have two arms, they're extra strong and extra supported. So I want to just take a minute and talk about why I like to use kettlebells for gymnasts. They do require finding stability in a dynamic environment. So that kettlebell is kind of not evenly weighted. So the gymnast does have to find and create some stability. Just like in gymnastics, when they're tumbling or on bars, high bar, rings, anything like that, they have to create their own stability. Second of all, they allow significant challenge with minimal loading. So like I said, I'm a fan of using weights for gymnasts to kind of mimic the forces that they need to endure, but we also don't need to load them up with as much weight as they could possibly carry, especially the younger gymnasts on their little joints. But with a kettlebell, you can challenge them significantly with a pretty small load. Also decreases compensations, like I said, when we have to, especially doing things where we're balancing that kettlebell upside down, it's going to be very hard to compensate. So we're going to see those things, and the athletes might not be able to even perform the movement without dropping that kettlebell down. So we can really see where they're working. Are you guys using them? So if you're not, I can help. I have not seen kettlebells in a gym yet. I do know that they are being used, but personally in the gyms that I've been in, I have not seen them. So I would really like to see them more. If you do need some help, I can work with you to create a program that is easy to use and individualized to your gym's needs. It can help protect against injuries and help you to select appropriate weights and when not to use weights. So early kettlebell training, instead of balancing that kettlebell upside down, I have my gymnasts balance a shoe or a yoga block on their knuckles. This way, like I said earlier, if they may not be able to do a certain movement without dropping the kettlebell, but we'd want to be careful with them actually dropping the kettlebell. And that's why we start with a shoe or a yoga block first. And if they drop that, it's not really painful, not really a problem. And then we kind of progress them as their ability progresses. So if you're interested in any of this, you can send me an email at info@perfect10pt.com, or you can respond to the email you get with the recording of this webinar. If you want to get in touch with me for that or any other reason, you can find me at info@perfect10pt.com, perfect10pt.com, on Instagram at perfect10physicaltherapy, or you can join my Facebook group, Pain Free Perfect 10. I'm in there a couple of times a week, answering questions, interacting, putting out some polls and some live videos, just kind of updating on whatever I'm seeing most commonly in gymnasts at this time. So just a reminder, we did get into some medical terms here and gave you some advice, but remember that unless you are a doctor, you are not a doctor. So what do I mean by that? Some of you watching this could be doctors of physical therapy, doctors of chiropractic. Then you're a doctor, and then you can take this information and do with it what you will. Use your clinical judgment and apply it as you can. If you are not a doctor, remember that you're not a doctor. And just learning something from a webinar online does not give you the license to treat athletes. Also, always give the athlete the benefit of the doubt. So this is something that I'm really sad that I'm still seeing quite a bit, where an athlete says something hurts and the coach says, oh, it doesn't hurt, or you just don't want to do this, or you're scared, or this or that. That absolutely can be the case here and there, but that's really for a professional to decide, not the coach. So if they say it hurts, it hurts. Make sure to follow up them getting the proper treatment. Nothing that we discuss, none of those exercises should be painful to do. If they are, that's a definite stop and refer to a medical professional. If your gymnast is having pain with some of these things, or they're having pain with that overhead motion or that T motion, that sprinting tool, they may need to back out of some practice events to build the strength back before they come back to doing all their gymnastics. Also with some of these rehab exercises, like I showed you, these are not yellow TheraBand movements. These are hard, intense movements. You can overdo it. So, don't take these videos, watch them and say, oh, we're going to spend a 4-hour practice tomorrow going over these 10 videos. Absolutely not. All these, 10, 20 reps on each side, and that should really be it. Overdoing it can cause more harm than underdoing it. So just remember that. All right. If you have any questions, feel free to let me know. Otherwise, that's all I have for you. You can find on my YouTube channel some previous webinars we've done, back pain, knee pain, things like that. If you have any topics you want to hear about for a future webinar, feel free to send me an email, and I will get back to you. All right. Have a great night.